So acid reflux, to understand why do many people suffer from acid reflux, you just need to understand that the gullet is a tube that takes the food from your mouth into your stomach. So there is no real physical door in there. So food should go from the mouth into the stomach, and then the stomach should have some sort of a door that closes and keeps the acid inside the stomach. Now this door, this entrance from the gullet to the stomach is not really shut very tightly. And it allows people, so you can burp, you can have the gas coming back through your mouth sometimes. So it doesn't really close very well. Now, that sometimes makes the acid comes the wrong way up into the gullet, into the esophagus, rather than going down the route into your small bowel. And because of the nature, the anatomy, how your stomach is connected to your gullet, you run that risk. So that is so now things that make your stomach has a little bit more pressure than usual, that can push the acid the wrong way up, things like obesity, and also some anatomical problems with the door from the gullet to the stomach. And this is very, very common and causes quite a lot of acid to come the wrong way up, causing you all this heartburn, discomfort, and the quite difficult symptoms. All right, now that we understand that the problem is with the door from the gullet to the stomach that doesn't close very well. So imagine anything that increases the pressure inside your stomach. Obesity, pregnancy is a big one that can cause a lot of acid reflux, but also sometimes the way that door from the gullet to the stomach, that it doesn't close very well. So the stomach can slide sometimes into the chest and just end up with a door that is wide open. And this is called hiatus hernia. Many people have this hiatus hernia, which is a risk factor of reflux. Other known risk factors, including smoking, which is uh, quite a significant risk factor for hiatus hernia. There are some food that they relax the lower part of the gullet, things like, for example, garlic, chocolate, red wine, and there is quite a long list. So it's really, you have to sit and talk to the patient and see what you're doing, and sometimes you can identify quite a lot of risk factor. All right, so if you want to avoid the acid reflux, you have to treat the root causes. And that is different from patient to patient. There are simple reversible causes, such as obesity. So that is weight loss. Obviously, it's easier said than done, but that can help with improving the acid reflux. Smoking, if you smoke, you need to stop smoking. Certain amounts, certain type of food can promote acid reflux, and we will identify those for you and try to help you avoid them. But there are other things, there are physical things, for example, eating before going to bed. That can be a risk factor. So if you avoid eating 3 to 4 hours before going to bed, sometimes the position that you take when you sleep can also be improved. So laying flat is a risk factor. Believe it or not, there are studies showing things like having a tight belt or garments when you go to sleep can increase your risk factors. So all of these things can help, but sometimes there are anatomical problems. There are large hiatus hernias. The door is completely open, and with these things, you really have to intervene with medications, or in rare situations, even surgery. All right, so if you leave the acid coming the wrong way up into the esophagus, so the esophagus is not designed to withstand acid for a long time. So that exposure is an insult to the lining, and the gullet will try to protect itself. Many times it starts to get inflamed, and inflammation can cause things like what we call fibrosis, narrowing of the gullet, making it difficult for you to swallow in the future. But also, inflammation is not a natural status. It's not a natural thing that your gullet has to pass a very long time. So that is a risk for some sort of cancers that they happen. Now, we don't want to scare people, but leaving acid reflux untreated for a very long time can result in strictures and changes to the lining, something called Barrett's esophagus, which also increases the risk to gullet cancer. All right, so with acid reflux, so one of the things that we can do is have a look at the lining of the gullet, make sure that is not very inflamed, there is no Barrett's esophagus. The way we do this is we use a camera that goes either through the mouth or through the nose, and having a look inside the gullet and the stomach. This is called gastroscopy. So gastroscopy is a test to see if there's any damage to the lining. Not all acid leaves damage and can be missed on gastroscopy. That's why you do things called esophageal physiology studies. So we put a catheter down the nose into the gullet, give you some sips of water, you drink, and we see exactly how your gullet functions. If it can push nicely to the stomach, or if it doesn't, and if there's any problem that is contributing to your symptoms. Now, after that, what we can do, we can also test the exact amount of acid that comes from your stomach the wrong way up into the gullet by putting small catheter that measures the acid or a small wireless capsule that is attached at the end of your gullet. Now, then you come back, you give us that device, we stick it into a computer and tell you exactly how much acid you've had, if it is contributing to your symptoms or not, if it is causing your symptoms, if it is causing the cough that you complain of, the chest pain, the heartburn, and then we can exactly tell you what are the best next step. Is a surgery necessary? Is a medication necessary or not? So these are the ways: gastroscopies, high resolution manometry, and reflux monitoring, 24 hours reflux monitoring or wireless reflux monitoring.